Good morning. I'm Dr. William Sunstein of NSPC Brain and Spine Surgery, and welcome to our 8th episode of the Spine Bros podcast.
And I'm Dr. Richard Obedian of Island Spine and Sports. Today we have a very special guest. He's also a former patient, and we'll ask him to introduce himself in a moment. His name is Avi Azoulay, and he actually had surgery almost a year ago today, a year and a couple weeks ago. So without further ado, Avi, why don't you tell us a little bit about yourself?
And tell us about
where you're from, what you've been doing before you came to be a patient, and how and what ultimately happened to you.
Okay. Well, my name is Avi Azoulay. Like you said, I was born and grew up in Israel. I moved to the U.S. in 1985. I was just about 27. I've been doing karate training and teaching since about 1971. And
how did you get into that?
My older brother.
Older brother.
Yeah, I have an older brother who went away to like a pre-military high school, and he was introduced to it, and he showed it to me. It was about 11, 12 when I started, and I liked it, so I continued training. And from there, I just went on.
And martial arts is very big in Israel?
It wasn't back then.
It is now.
But today it is.
They teach you that in the Army?
Well, they teach in the Army, they teach Krav Maga, self-defense. They don't teach karate to the extent that I do it or that I teach it.
Right, Krav Maga has a portion of karate in it, but it's really more of a self-defense.
Krav Maga is a combination of different attack and defense techniques from various martial arts. It's not just from karate.
It's really an Israeli invention.
It's an Israeli face-to-face combat, which really that's what it means. Krav Maga means contact fight,
right?
Basically, and they teach it in the army to certain units depending where you go and so on and so forth. And then but they don't. It's not like a whole progress of years of learning every little bit.
So it's not as formal as karate, where you have different belts and.
No, it's not as formal as that.
So how old were you became a black belt?
I was 17.
17, pretty young.
It was normal. It's been 5 years or so since I started training, and it was about the normal pace. I was 17. Yeah, I think it was January of 1977.
Are there a lot of dojos in Israel?
Today there are. Back then it wasn't. Back there it was more like an underground culture, so to speak. But today, with karate growth around the world and competition, sport karate, they have a lot of schools in Israel. It's everywhere. Different style.
Well, especially now with like mixed martial arts and these.
Well, they have
so many things to basically be aware of in terms of martial arts.
It
gained popularity.
Yeah, it became very popular over the last 20 years.
Muay Thai.
It's Thailandese from Thailand. Every country has their own martial arts.
Was that in the White Lotus?
That was in the White Lotus. I was thinking about that because of the White Lotus.
But so in 85 is when I moved in here.
When you came to the United States, so you did the army in Israel.
Yes, I served in the IDF.
And because you were a black belt in karate, did you have any kind of special treatment, or
No.
were you in a special?
Well, you do what they tell you to do.
You don't ask questions.
Yes.
Did you become an officer, or you were just an enlisted?
I was an enlisted. As I got closer to finish my 3 years of service, my commander offered me to go to officer school, but I didn't really want to stay extra years in the military, so I decided to get discharged, which I was after 3 years and 3 months.
And during that time, you were maintaining your karate skills?
I trained.
Still training.
Worked out. There's on the base. There's always like a gym, and so I always.
Why did you want to come to the United States?
To expand my karate horizons. Basically,
Really?
I got an offer from a good friend of mine who was my sponsor to come to the U.S. He had a karate school in Queens. He came to Israel for the Maccabi games a couple of times. He came to the school where I trained, and I met him, and he said to me, if I ever decide to come to the U.S., he'll offer me a job in his school.
It's interesting. Israel seems to always do well in the Olympics in martial arts, right? In judo
In judo, yes.
Judo more than karate. And what's the difference between judo and karate?
Well, karate is really not in the Olympics. It was exhibition sport in Japan, but that was it.
That was it.
It's not going to be in for the next couple of Olympics.
But judo is in the Olympics.
Judo is in the Olympics.
So what differentiates judo from karate, really?
Judo is a lot of grappling and throws and so on, but karate is more like kicks, strikes, punches, and so on. So in order for you to actually execute judo, you have to grab onto each other and throws, and then there's some grappling involved on the ground.
It's almost like wrestling with a martial art.
A lot of like the MMAs that you see today, whatever, a lot of this derived from judo.
What do you call that? The grappling and the formal word for grappling technique in.
Well, they have jiu-jitsu, which is another type of martial arts.
Jiu-jitsu.
But a lot of it originated from the grappling in judo. But it's been a sport for a long time, and it will maintain to be a sport.
Karate, though, is that where you break the, with your hand? That's popular culture that you see people bringing multiple boards.
Board. That's karate mainly.
Well, no, breaking board has nothing to do with karate. Anybody
nothing to do with karate. Oh,
it's just the stigma that
you think of the Karate Kid?
No,
Hong Kong Phooey, the Karate Kid.
Karate has nothing to do with breaking boards. Anyone can break boards. You don't need any karate training for it. Karate primarily, it's not just the physical part. A lot of it has to do with the mental part. A lot of it has to do with teaching dedication, focus, balance in and out of the karate school. So it's not really about the kicking and the punching only.
And it's a Japanese martial art.
Yes, it's a Japanese martial arts, Okinawan Japanese martial arts. And it takes, I have students who have been with me for like 28 years, and they're still training. And they're in their 70s.
Wow.
And they're still training.
Really, 70-year-old karate masters.
Well, they come like 2-3 times a week. And
it's good exercise, but you're saying it's spiritual aspect as well as a physical aspect.
It's mental and physical. But it's, the average person, when you say karate, they keep thinking about what you said, breaking things and and kicking and punching and jumping up in the air. Yeah. Well, it's not only that. That's a small part of it. It's more the teaching you how to become. The first thing that you learn karate is about development of the character. And that's more the mental part, the psychological part.
Right, controlling it, because you don't want it to get into the hands of the wrong person for wrong reasons.
More about that. It's not just about, kicking and punching. Anybody could do that nowadays.
I don't know. I may have my limitations.
Well, some can do it better than others, but
I need my cortisone shot to basically do the kicking and the punching.
That's what makes it an art.
Well, that's the thing is it's not, and also it's not a comparison between you and you, because everybody has different body type, different abilities, different capabilities. So it's how better you can get compared to last week of you.
Right, that's good.
And how you can
competing against yourself eventually.
Exactly.
And making yourself better.
Somebody else. That part is sport karate. You go and you compete against other people. But in true karate-do is how you get better personally every time.
Yeah, that's fascinating.
It's a lot of years. I talk to my sensei, my instructor, pretty much 2-3 times a week. And
your sensei still alive?
Yeah, he's going to be 88 in July.
Oh, wow. And is he still in Israel?
He's in Queens?
No. The original sensei still lives in Israel, but, since I moved, I joined a different organization and different group. And my current instructor, I've been with him for like a few decades now, he lives in Hungary.
Oh, wow.
Wow.
Yeah, he lives in Hungary.
That's why you went to Hungary. I remember you mentioned that when I
That's why I go to Hungary every year.
Yeah.
Every year. And then he comes to the U.S. once a year also, or a couple times a year, depending how often we bring him. But we still...
But he's 88 years old.
He's going to be 88 in July.
And he's in good shape.
He's in decent shape. He trains, he teaches, so Every
That's
time
great.
I talk to him, you learn something new.
Hopefully he lives to 120.
Hopefully. You never know.
So anyways, let's get back to you. You were in Israel, and in 1985 you decided to come to the United States.
Yeah.
And that was after you completed your 3 years in the Army. And were you working in Israel as a karate instructor, or you had a karate school there as well?
I had 2 schools in Israel that I taught during the week. And one of them, I just rented the space for 2 nights so I can teach. The other one was mine full time. And I had different programs in it. I had judo, I had jazz, I had,
Everything.
More like a center.
Community center.
And I sold it when I decided to move to the U.S. Well, originally I didn't know I was going to move. I was planning. There was a program in LIU in Brooklyn that combined with science. It was specialized for karate instructor program. So it's like about a year and a half. Every couple of weeks you go, you spend the whole day in the university. You're learning the physics parts of karate, and you learn actual physical part, and then you get certified as a karate instructor by LIU.
So there's a certification process.
Yes.
And there's a science to it, obviously.
Yes. So there's a science to it. Yes. So I did that. That was my intention, to come and do that, but I wasn't sure how long it's going to be. So I sold my business. But as I was here, I decided that I wanted to stay, and I got selected to the U.S. team for the Maccabi games in '88.
Oh wow!
So
did you go?
Yeah, I went to Israel in '89 and in '93 as a member of the U.S.
You know, it's funny. I was in Israel in '89 during the Maccabi games.
I was on the American team.
I was a counselor for a group of kids that were on a teen tour, and that week Israel was so crowded that there were no hotel rooms.
Yeah.
So we were told by the tour director, you have the week off and you're on your own. And we ended up going to Egypt for the week.
Oh, okay.
Oh, that was the week you went to Egypt.
That was the week I went to Egypt, because there were no hotel rooms available, because the Maccabi games were really a big deal.
It is a big
in Israel.
Deal. Well,
it's mainly in Tel Aviv.
They play all over the country.
No, all over the country. It is the 3rd largest sporting event in the world after the Olympics and FIFA.
It's basically a Jewish Olympics.
That's basically it. Last time in 22, we had over 10,000 athletes for all sports.
Wow. So you're still involved with it?
I'm going this summer. I'm the chairman for the Maccabi karate team.
If you guys need a team doctor, Dr. Sansky and I are,
we're more than
available.
To support you with that.
I'll move the word up the ladder.
So I remember when you first came to me. How did you first come to me? Actually, I was trying to
by chance.
It was just by chance.
So in 2015, I hurt my back shoveling snow. We had like a 4-foot snowstorm, and I was shoveling in, and I was talking to a friend of mine there. I said, I don't know that my back would not have been hurt otherwise, but shoveling the snow, what brought it on.
Because you had a long-standing history of back pain prior to coming to see us.
Correct. So from 2015 until I saw you, I like once a year I would go and get like the epidural shot into my spine. So it was working for like 11 months. So I did it 2-3 times, and then suddenly became like 8 months. After 8 months, I started getting the pain again.
And the pain was mainly your back, or was it going down your legs?
It was going down my legs. It was going to my my hips.
Your hips.
Your groin.
Growing area of my hips, and going down my left leg.
Left leg.
The left leg was more than the right leg.
So it was, as I did it over the years, the effect of it became less and less. So when I saw you, I had to cross the street from your office. There was a back.
The pain management specialist across the street.
I got the shot, and 2 months later, I was already in pain. I'm like, okay, that's not doing it. So I actually looked around, and I, by chance, I found your office, not too far from me. I said, okay, let me go for an interview.
Sure.
Doesn't hurt.
Absolutely.
And here we are.
There you go. I mean, that's how it works. Well, a lot of people.
Well, it was a little more complicated than that.
They certainly look at the the internet and everything like that. Nowadays, you can really look up a doctor.
Right.
Check them out.
Well, I also looked onto my health plan and whatnot, and then we took an MRI, And
Right, because you needed a new MRI, an
right,
up-to-date
and
one.
you compared it to the one from 3 years ago and so on, and
Right, because this has been an ongoing problem for several years.
yes,
And you were basically not getting, you weren't getting the same relief
No.
from the injections, the epidural steroid injections. You also had RF ablation, radiofrequency ablation, or some kind of
when
burning of the nerve.
when I first started with that, they were doing also that burning the nerve edges, whatever,
Yes.
in that area. But that doctor who was doing for me moved out of the facility, and that's when I went to the one in Bethpage, and that was across the street from your office. And then
What do you think of that RF ablation?
I actually was going to say, I personally, I have not had great experience with it. I just find that it doesn't work all the time very well, either in the neck or the back.
I'm not a fan.
I mean,
either.
basically, the concept is to burn selectively the pain fibers that supply the joints that are in the back of the spine that supply pain, and selectively ablate them.
At best, they give you temporary relief
it was
because the nerve
temporary.
comes back.
It really shouldn't effectively improve a person's leg pain. That's usually for the epidural, where you actually deliver the medicine into the canal where the nerves go. And when we had the new MRI you had done, your main problem was at the L3-4 level of the lumbar spine. So basically, we got in the new MRI, what you had was overgrown or enlarged joints in the back of the spine. So you had stenosis, you had narrowing of the canal. It was worse on the left than on the right, and I think that accounted for the fact that the pain that was going down your leg was more down the front of your leg in that distribution. And also, he had some stenosis at L4-5 as well. But it was a very interesting thing about his films. When we got the films, we got flexion extension X-rays. You had a slight misalignment of the bones. Very common problem in degeneration of L3 on L4. But when we did X-rays with what we call flexion extension, he moved.
There was motion.
He had like about 6 millimeters of motion.
You had instability to your back.
At that level. You had instability as well. And I think that was probably really accounting for your back pain, your constant back pain that you're having, because you're always in motion, and obviously what you do.
Spine surgeons call that a spondy or a spondylolisthesis.
Spondylolisthesis at L3-4.
It was a slight slip on plain films, but it did move when you flexed and
It
extended.
exaggerated. So we actually, we actually have the films up here, so you can see right here on the projection the flexion extension X-rays, and you can see actually right there, you can see on the flexion portion the 6 millimeters approximately of movement on the L3-4 level. And if you look now at the MRI, you can see on the axial images or the cross sections, you can see the stenosis at the L3-4 level, and you see that well also in a sagittal as well.
Yeah, there's clearly pinching of the thecal sac.
So
narrowing.
So we saw that, and Dr. Abedian saw you as well, and we basically decided
we requested surgery for you.
You were suffering.
Now, what was interesting about the request for the surgery was that you described you went through all these, you're in very good physical shape. You run a karate school. You're a karate instructor. You are in tip-top physical shape, but you've had multiple epidural steroid injections. You've had multiple RF ablations, multiple treatments, and the insurance company refused to authorize the surgery. And so I appealed it because I had sought the authorization. So I appealed it, and I spoke to...
You had physical therapy as well, formalized?
Yes.
He had physical therapy in the past.
Right,
It was 3 years before.
Right, but it wasn't present.
Correct.
It wasn't a present physical
And so I spoke to the director. I won't mention the name of the insurance company because we don't want anybody assassinated from the insurance companies. But the insurance company director, who was not a surgeon but was a medical doctor, told me that they were going to deny the operation because you did not have documented physical therapy during the past 6 months. And I countered and I said, but he just had an epidural steroid injection. He just, you allowed him to get that. And her answer was very revealing. She said, well, The epidural is just temporary. A laminectomy and a fusion, that's a permanent operation. I said, well, isn't that the point? We want to get them better permanently. And they stuck by their guns, and they refused to approve the operation. And it took us a few months, and we finally got it approved after Avi had to go through.
Because originally it was supposed to be in November.
That's right.
And then we
got postponed for like almost 6 months, 5 months.
Yeah, we ended up doing in April. It was postponed like 3 times.
Which is ridiculous.
Because they wouldn't approve it. And then I had to go to do the PT upstairs.
Right, you did it in my place.
Building.
That's right.
I had to do it for like, I think, 10 sessions or something like that.
Yeah.
Did it make you feel any better, the physical therapy?
No.
Because I think the problem is that when you're when you have instability, chronic instability, there's only so much the physical therapist can do.
Well, the only thing is also, not to demean the physical therapy, I do more than they ask me to do over there every day.
Right. Absolutely. You're
I mean, the physical therapy works, I guess, will work for people who don't do any physical activity, and for them it works. But it didn't work for me.
There's a role for physical therapy.
Yeah.
But in your case, it was moot because you had clear instability of your spine, you had clear stenosis, and your physical exam findings and your symptoms were matching exactly the kind of symptoms we would expect somebody to have who has stenosis, which is worse on the left side with the left side leg pain, the instability of your back with this constant back pain, and you were very limited.
And you had pain in the distribution of L3-4, which was the worst level he had. Just for the audience, to again, as a reminder that, if the spine has got instability to it, the spine signals itself to try to auto-stabilize itself by making bigger joints and by thickening ligaments that already exist there. That's what creates the stenosis, and the nerves become collateral damage because the spine doesn't care about the nerves being there. It's going to do what it has to do to auto-stabilize itself. So, and what's also interesting, too, just as an academic point, most people with spondylolistheses in patients with, let's say, a degenerative spondylolisthesis, which is what you had. This is in comparison to the congenital variety, which is usually at L5S1. We're talking about L3-4, L4-5, which are the most common levels of the degenerative type. That even at 15% of those patients will develop some obvious instability on flexion extension films and not just be fixed. So you fell within that category of that 15% of patients who actually have gross instability on flexion extension films with a degenerative variety spondy, if that makes sense. But I think that does.
Yeah, so finally we got the approval.
We
took you to the operating room. I believe we did it at Winthrop once again.
Our goal was to do what we did. We were going to do
we plan on doing a decompression or a laminectomy to take the pressure off of the nerves that were being pinched. And because of the instability, we also did a fusion on you. Because you were in really excellent shape, we try to keep your back as stable as possible and not remove too much of the facet joint to make you can get something called iatrogenic instability, which is that when we go to the operating room, if we remove too much of the bone, your back can become even more unstable. And then you almost guarantee that you need to have metal hardware and a solid fusion.
Which I didn't.
Which Avi had indicated that he really didn't want to have hardware in his back. And if you had hardware, I don't think it would have really made that much of a difference. But so we honored your request, and we ended up doing what's called an in situ fusion, which means that we took your bone that was removed from your spinal canal that was pressing on the nerves, and we recycled it. We have a special, expensive blender, for lack of a better word.
It separates the soft tissue from the bone.
That we take the bone that's removed from your spine, we put it into a blender, and it
gives us
we get a slurry.
Material that we
get a
need.
slurry of bone, like little bone fragments. Bone. I think Dr. Sanson likes to call it bone dust.
We like to use bone dust on patients for instability.
So, and we combine that with some bone marrow from your hip, and some
other graft extenders
and bone graft extenders as well. And we put that in combination with with a substance called BMP, bone morphogenetic protein, which is a hormone that causes healing, and it causes the fusion to take place very quickly.
I think it was a good compromise rather than using screws, because when you put screws in, sometimes what happens is that the upper screw particularly, will affect the joint above, and that can cause you to have a neck segment problem in the future. I think more so than even if you basically did not use the instrumentation. So I think it was good that we just put the bone dust on the sides.
I'm glad you did.
In addition, so I think for somebody like you who just needs that high level physical functioning, I think this was a good compromise.
And the results of the fusion were amazing. You went on to heal incredibly quickly. And well, tell us what happened after you did, what
was your experience?
What was your experience in the hospital?
Pre-hospital,
Well,
in the hospital, after the hospital. Tell us about the whole thing.
Well, first of all, I had my doubts about going into surgery. I don't like surgeries.
Yeah.
Nobody wants to go into surgery.
I had my little mental
Come on, you're a strong karate expert. How could you not,
He's
mentally
an
prepare
Israeli
for that?
army veteran.
I think
handle
it was,
anything.
I think it was a Friday, April 12th. I think it was a Friday.
You did this on Shabbat?
No, Friday morning.
Shabbat is Saturday.
Friday morning.
No, I know, but we did this obviously on Friday night.
Yeah. So
Friday.
when I
Shabbat.
woke up, well, obviously there was discomfort, and I think I was in the hospital for about 3 days.
Sounds
I think
about
I was
right.
discharged on Monday.
Yes.
That's pretty good, actually, getting done Friday and getting out Monday.
Yeah, and it was good. I mean,
Did your leg pain get better right away?
well, I was walking. I believe I actually got out of bed and walked with my IV thing to the bathroom by myself.
Did you notice a difference right away?
Not right away, because I was too troubled by the actual
Incisional back pain?
the back pain that I had from the surgery, from the incision. I was too concerned with that, so I didn't really pay attention much to that pain, and I was obviously moving very slowly.
He was walking by himself the day of the operation.
Yeah, no, I mean,
to the bathroom.
tremendous.
That's pretty impressive.
That's one of our goals, is to get the patient up right after their surgery, not to languish in bed.
Yeah, no, that was good. In the hospital, I started the next day. I think I had the PT nurse came, and we walked up and down the stairs a little bit in the hospital, and I was walking around by myself and doing things. I actually painted them a mural over there in the hospital outside my room.
Oh, yeah, they had you do that?
Well, yeah, they had one of those drawings that you fill in by the numbers.
Okay.
So I stood there for like a few hours and did.
The day after the operation.
That
I didn't know about that.
That's the news to me.
So they have that for patients?
He's
that
also an
basically-
artist.
He's an artist,
Well,
but that's...
it was easy. It was just
Color by numbers.
Coloring.
So coloring, basically, they have the patients do after the surgery, and you have to stand there to do that.
Yeah,
Okay.
and I stood and did it, and so it was good. I mean, obviously there was the issues of dealing with the IV, with walking gingerly and so on. But I was walking, so I felt much better. Over there, and the hospital was fine. There's no problem.
They treated you well there?
They treated me very well. It was really
great.
nice. And I think Monday midday, I think I was discharged
This was done at Winthrop,
in Winthrop in Mineola.
NYU,
Langone.
Long Island, Langone. Yes. Now that's called it.
Yeah, I don't know if they call it Winthrop anymore, but yeah.
We still do, just by out of habit.
Yeah.
I think most of the doctors still do, actually.
And so that went well, and I had visits from the doctors. The one who used to be in your office, he visited me and checked on me, the nurses. So it was the hospital stay was fine, and then we got home. I got home, and I had 2 weeks that basically I was not allowed to do anything because my daughters were there guarding me.
How many children do you have?
I have 3 kids.
3 kids.
So
and you have 1 daughter, 2 daughters, and 1 son.
correct.
So the girls are very protective of their dad.
Well, my son is still between the Marines and college. He was busy.
He's a U.S. Marine.
He's a reservist Marine.
Oh wow!
Until he finishes college, then he will go to full time. But my daughter came from D.C. No, from Pittsburgh. The one who came from Pittsburgh the first week after the surgery. She took care of me. She wouldn't let me do anything except getting out of bed and into bed by myself. And I have stairs in my house, so I went up and down the stairs, as part of my self PT. I had a
Right.
PT nurse come in a couple of times, but after that I said, I don't really need you. I do.
Yeah, the visiting nurse, the visiting physical therapist, they just take you for a walk. You make sure you're okay. They don't really do as much as and you were doing really, really phenomenally
so
well.
it was fine. And then the second week, my other daughter came in from DC. So for the first 2 weeks, I couldn't do much except my local PT and up and down the stairs and walking outside a little bit in the backyard and stuff like that.
But that's fine. I mean, that's kind of what you want to do when you're recovering from this type of surgery. It's a big surgery, a big incision
But
to have to go through.
I'm not patient. I'd like to get things done and move.
Were you thinking about?
He has that Israeli mentality. He wants it done like yesterday.
Oh yeah, but were you thinking about God, when do I want? I really want to go back. When did you start thinking about like how you could go back to doing what you do, with the karate and everything like that?
The day after the surgery.
You were starting to think about that.
The day after the surgery.
You traveled soon after the operation, didn't you?
I was supposed to go to California in May, but I canceled that.
Okay.
And then I traveled in July. I went to Florida for a week.
For tournaments that your students were
for
involved
the
in?
national championships. I took my team. And in July, I went to Hungary.
Wow. See, that's pretty soon.
Pretty impressive. About 3 or 4 months later, he's traveling.
He's traveling to Europe.
Yeah.
Florida and Europe, yeah.
And then I think in October, I went to Germany to teach a seminar. 2 weeks after the surgery, I was basically back in the school teaching classes.
Really?
I wasn't doing a lot of stuff that I normally would do, but I was already moving and doing things in slow motion. Let's put it this way. But I was already teaching classes 2 weeks after the surgery.
But in your mind, from the day one, you said,
I was thinking,
it's a question, when am I going to get back?
Yeah.
I'm ready to go. You were raring to go.
Things. I couldn't do it because my daughters were there and they wouldn't let me.
When did you notice that when did you notice that your leg was improved, or what was improved about you?
Pretty much when I got home, because there was no pain in the legs or in the hips. The pain was only in the back where the incision was, and
that's what we want.
And it was getting better every day.
It's a healing pain.
Yeah, it's a healing pain. So I had to kind of like figure out a way to get in and out of bed with a roll and sit and whatever. And
you want to avoid twisting your back when you get out of bed. So
yeah.
you get
So
the log roll.
So that's. There was no pain in the legs. It was just in the incision.
And how about the numbness that you had before?
It's not there.
Gone.
It's not there.
It went away right away as well?
Well, as soon as I started teaching classes, I noticed it's not there.
That's right.
So it was fine. I was moving fine, and I mean I was moving slower still, but as I was moving, I noticed there's no numbness, there's no pain, just the tenderness of the muscles in the back, that I have to watch.
At what point did you go back to your full activities that you were doing before you were even hurt your back? Like grappling with students.
I mean, right now you're a year out from surgery. Are you able to function the way you functioned before?
Yes, I actually started competing again.
Well, that's tremendous because I want our audience
so
to
you're
know
competing.
that.
What kind of competition? You said you're going to Maccabiah Games next.
Well, I'm the chairman, so my job as far as the Maccabi organization was to advertise and collect and select a U.S. team to go to Israel and do all the admin work to get the team to get on the plane. Once they get on the plane, my job is pretty much done. It's the coaches that take over. So I'm going there, I'm just going there for support.
And that's going to happen next year?
This year.
This year, 2025.
Yes, this year. July 1st, the team gets on the plane.
It's definitely happening.
Oh, yeah.
With all the stuff that's going on there.
Oh, yeah.
I mean, I just want to, because people always ask me in the office, like, when can I go back to doing this? When can I go back to doing that? And this is, I mean, here, karate is, I think is probably one of the highest level functioning of any physical activity you can do, what you do. And to be able to say you can go back to doing that kind of level of training gives people hope, I think.
I think that I pretty much went to almost full mode probably at the end of the summer after the surgery.
About
I'll
3
probably
months
say
later.
like something like September, October.
I mean, I think that is on a bell curve. You may be on the higher portion because of your just level of fitness before the surgery, which I think really speaks to how important it is for people, if they're going to have spine surgery, get preoperative physical therapy and things like that to really get themselves into shape for this type of thing. But that's fantastic, and that just goes to show you that, if you have surgery of this nature, you can go back to doing stuff.
I always tell patients, use pain as your guide. You can do things, but pain is God's way of telling you it's a little too much right now.
Yeah.
So you can push it a little bit, but every patient is different. It's like you said before about the karate students. Every student's different.
It's different.
And everybody heals at a different rate, and everybody has a different pain threshold of what they can tolerate. I had a patient yesterday come in who was about 6 months after a similar operation to you, but he had screws put in. And before the operation, he was running 3 or 4 miles a day. And he said to me, he said, my friends told me I can never run again. I said, well, how do you feel? He says, I feel I can run. I said, have you tried it yet? He goes, yeah, I already ran a couple miles a day. Is that okay? I said, of course it's okay. We want you to get back to your, the point of the operation and the point of the surgery and a successful operation is to get you back to your, to where you were before.
Before you started having all the problems.
So,
before these symptoms started.
Speaking of that, I used to run a lot. Psychologically, I'm afraid to run because of the impact on the spine, and I miss it. I used to run a lot.
You can run.
Okay,
Start slow.
You can run. I certainly advocate walking to begin, and then jogging.
Well, which I do. I go to the gym and I get on the elliptical and I do like 3, 4, 5 miles.
That's very good.
Aerobic activity. That's like the equivalent of running.
Yeah.
Yeah.
So but I used to compete in running in high school, 5 and 10K.
Yeah.
You could definitely go back to
now
run.
you're still competing in karate, though. You said
I started easy a couple of months ago. There's 2 aspects of competing in karate. One is the forms that you perform, a routine, and you get points on it. Let's say the equivalent of the floor exercise in gymnastics. You have a routine, you have the motions, you get points on accuracy, energy, power, and so on and so forth. And then is the fighting. The fighting, I'm not back yet. Again, it's all in my head. In the dojo, I do. In the karate school, I do that, but not in competition. And that's only because it's in my head, not because it's limited. So I'm working through that.
And when you compete, do they have different age categories?
Yes.
So you're in the which category do you compete in?
Well, it depends on the tournament. Some competitions don't offer 18 to 34 and 35 and over. Some will have 45 and over. They'll break it by 10 years and so on. It depends on the competition. So sometimes at the last tournament I was competing against guys who were like 15, 20 years younger than me.
That's great.
But you held your own.
Well, a gold medal is still a gold medal.
Yeah.
You got the gold medal.
Yes.
That's awesome. Okay.
So,
But there's just rising to that level of being able to compete is impressive, and winning the gold medal is even
Actually, I'm scheduled to go to Chicago next weekend, not this weekend, the following weekend, and I'm scheduled to compete in Chicago.
We wish you well with that.
Thank you.
What is your secret that makes you a gold medalist in at your age?
It's got to be mental.
It's got to be just
there's a physical component
consistency, training, dedication, the whole thing. It's like you have to do it. I do it every day.
And you've had it since you were doing this since you were 11 years old. You've been a kid.
About 11.
And I think that mindset helps you recover from a major operation like you underwent.
I just don't want to sit down. My kids would tell me, "Oh, take it easy." I'm like, I'm not going to sit on my butt and not do anything.
Well, I mean, when you compete, I mean, you do karate. I mean, you get hit. You suffer discomfort, pain. People hurt you when you get hit, right? I mean, so you're used to kind of dealing with that.
My son keeps telling me the Marines logo. He says, "Pain is weakness leaving your body."
Right. So that's the thing. I mean, you've been dealing with pain for your whole life, essentially. So you have to kind of have a mental ability to deal with that.
Yeah, no, and I enjoy it. I really, truly enjoy it. I enjoy the competition. I enjoy training. I just enjoy
No,
doing
it's
what
a
I do.
love. You have a passion for it. You've been doing it since you were a kid, and you haven't stopped. It's you're living your dream.
No, I've not stopped training since, except for the surgery.
I think it's really actually great to have like some sort of thing that you have like that, that you've had your whole life. And, if you end up having surgery of the spine, anybody, to have that sort of thing you have in your background really helps, I think, drive you through your recovery because you want to get back to doing that sort of activity,
Yeah, it's a good motivator.
It's a very good motivator,
Yes.
Yeah.
And I feel like I have an obligation to my students.
Yeah, to continue
to be
on.
there.
So that's really that's another motivating factor.
So
Yeah, everybody needs a reason to live, a good mission.
well, I started my school around in 1987. I haven't stopped teaching since.
Where is your school exactly that you teach
It's in
at?
Syosset.
It's in Syosset.
Yeah, it's in Syosset. I've been in the Syosset Woodbury area since '87, and I have adults who've been with me for decades.
It's fantastic.
So it's like
Have
you
a
feel
following like
obligated.
that.
Yeah,
Yeah. No, that's impressive.
yeah. And I've had kids that were on the national team, traveling outside of the U.S. with the national team. So I was like,
Wow.
we're doing something right.
Yeah, no, it's a wonderful thing you do, especially for kids to. I think builds a lot of character to be, and certainly the students. It basically their drive. I think for a lot of things in their lives, I think is helped by going to your karate school and.
Yeah. And you're not taking any more painkillers or
Oh no, I haven't.
anti-inflammatories, muscle relaxers,
No, I have
gabapentin, or
I've not
those.
done that since, I don't know, months and months. I mean, I still have, I think the original one that you prescribed for me still sits there.
Still sits there.
I-
Yeah, which is great also to be off the medications.
I don't like medication,
Yeah, if you can,
basically.
and I guess you have to have a strong core to because you said part of the karate competitions is doing a floor program where you show your strength.
Yes.
So you've got a strong. I think that helps with your back as well.
Oh yeah, I mean, it takes the load off the spine and,
Yeah.
and that helps your healing.
Well, you have to. I mean, karate is one of very few sports that when you do it intensely, it uses every muscle in your body. It does. And, and if you want to get strong in it, you have to get cross training. So we do a lot of cross training, especially with the kids who compete. We do fitness classes for them in addition to the karate classes
To build their stamina.
to build the strength of the body and the stamina as well. But the stamina is, something that you have to do like an aerobic exercise. But to build their core and the strength, we do fitness classes for them.
You got to be in shape.
And it's called, so they got to be in shape. But generally speaking, when you do karate, it works all your muscles in your body. So
How about stretching? Do you guys spend a lot of time stretching?
we do stretching. It depends on the group, because the classes, unfortunately, are only an hour long for the students. So we do like a quick warm-up and stretching. But the students who are older and advanced enough, they'll do extra on their own. So they have the guidance how to do things on their own. So we don't have to, take a whole class and do half-hour stretching.
Right, because that takes away from learning the techniques. I
Exactly.
remember my son took karate, and I remember like the sensei. She when she warmed up, I remember she made them do all kinds of maneuvers. But one of the things they made them do was to basically rotate their neck around
Yes.
a lot to make sure because when you think about karate, you're moving your head around as well. You want to make sure that's limber as well. Your neck, you're
Of course.
you're moving that suddenly in this way and that
When
way.
we do warm-up, we start from the head and we go all the way down to
Because
your feet.
everything's in play
stretch.
there.
Yeah. So, yes, you do.
What was the hardest thing to come back from the surgery for you?
Kicking.
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 Interesting.
Because when you kick, you stretch your back muscles.
So that was limiting.
And was limited until it got better. And now I can kick and all that, but in the beginning, it was something that I had to be very careful about.
Very careful about.
So I would do it, but I would do it in slow motion.
Well, maybe we'll have to have you show us your whole floor routine or something like that. Another episode actually to show us like what you can do.
You can bring the cameras to the dojo and take a picture.
And we can then show your incision to prove that you actually had the spine surgery after that.
Well, I think you have enough X-rays of my body.
I had a patient. We had a patient actually. We did a long time ago. I remember he sent me a video. He did his whole. He was a karate expert. He was a real G.I. Joe kind of guy.
He was a mixed martial arts competitions.
Remember that guy?
Yes.
And he did this great video. He said he did his whole routine on the floor. All the maneuvers that he can do and everything like that. And this was literally like a week and a half, 2 weeks from after his surgery, and it was a lumbar surgery. And then at the end of the routine, he turned around, he flipped up his back of his robe, and he had his fresh incision right there, that he had just done, just to show that he had just had spine surgery.
He went on to win competitions, and he went back to combat.
Yeah.
Like fighting, and we ended up operating on his mother as well. She did well too.
He also operated on his wife.
Yeah, there's a whole family.
That's what happens sometimes,
Well, that's the best referral, is a referral from a family member or another patient.
Absolutely.
They have pure trust in you. If you did well on my son, you'll do well on mom.
Well, absolutely.
So that's wonderful. So you had the surgery, and now you're back to going around the world, competing and teaching, and and organizing, very big Olympic style games. That's amazing.
Did you have any students ever go to the Olympics?
No. The karate competition and the Olympics.
There's no Olympics. There's no karate in the Olympics.
There's no Olympics, and the one.
But there's judo though. There's judo.
There's judo. And the one that were in Tokyo, it was more like an exhibition type sport. So it was
trying to get it to become a sport.
Yeah, it was very, very limited, and it's the next two Olympics. They're not going to have karate. It's already decided.
Okay.
So
we'll just
I don't have to worry about that.
But the Maccabiah Games have karate.
Yes, the Maccabiah Games have karate. They've had karate since 1977.
Can we watch those games on TV?
I think they do. They do stream the games. I'm not sure.
Probably on YouTube or the internet.
Well, I believe the Maccabi USA website does have a link to stream the games once the game starts. But I'm not sure which sports they're going to show when and where. I'm not sure of the schedule, but they probably have it on their website. It is a big event. They have, like I said, last time we had over 10,000. The U.S. team alone in 22 was about 1,200 athletes, delegation for all sports. And we're expecting about the same now this year to go. It's 3 weeks for the U.S. team to travel over there. The games are 2 weeks, and there's 1 week what they call Israel Connect. So they take the team a week before the games, and they take them to different sites in Israel to teach about not religion, but Judaism, Israel, history, connection.
That's really good, because a lot of those kids have probably never been to Israel.
Correct. A lot of these kids is the first time.
They have no connection.
They take them to Masada, they take them to the Dead Sea, they take them to Tel Aviv, they take them to Jerusalem, they take them different places so they can
that's
understand.
really excellent. That's great.
And that's a program that only the U.S. does for the Maccabi Games.
That's wonderful.
So
and they do that Israel Connect before the Maccabiah Games start?
Yes. So it's the week before. They travel, like I said, July 1st is when they travel to Israel, and I believe the opening ceremonies is July 8th or 9th.
Yeah. No, it's a very big deal in Israel.
It is a big deal, and every sport is being held in different parts of the country.
Are these only Jewish people that are competing from here? I mean, in the games, or are they?
The Jewish athletes, yes.
They're all Jewish athletes.
They're all Jewish athletes. Well,
from the United States, though.
From the United States, they're all Jewish.
They come from other countries too.
They come from.
Yeah, but I mean, I'm just wondering, like, it'd be interesting to have other faiths basically go and travel and get exposure to some of that before the games.
That's what. Well, the reason
be educated.
The reason why the Jewish Olympics started is because the Jews were not allowed to compete back in the early 19th century in the regular Olympics, so they started
Started their own.
Maccabi.
Isn't it
Maccabi
funny how like
movement
that is
started.
always the case? Like, you know, the Jews weren't allowed in Ivy League schools, so we got Brandeis basically established in 1948.
Albert Einstein College of Medicine.
Albert Einstein was a mess. We're always doing that kind of stuff, you know.
Well,
we always have to do that. We find a way, though, you know.
Yeah.
Find a way.
So, you know, that's how it started, and it grew. It started in Eastern Europe, and it grew, and now it's pretty much every country in the world, you know, they have a Maccabi movement in the Maccabi clubs.
I'd say one thing.
there are Jews all over the world, places that would surprise you.
Yeah.
Oh yeah. Well,
India,
Yeah.
China.
well, like
Africa.
our last guest, you know, from the Dominican Republic, that was very interesting.
Yeah.
Yeah. They have, it's a big movement.
Yeah,
When
absolutely.
was the last time you were in Israel?
Last summer.
Last summer.
I
So that was after October 7th.
Yes.
How was that?
Somber.
Somber. Yeah.
Yes.
Still somber there, I
It
think.
still is. It still is. I spoke to a friend of mine in Ashkelon a few days ago. It's still, you know, life goes on, but it's still
Still painful.
painful.
What's
They-
about
they're
the?
still
I
dealing
heard
with
something
it.
recently about sharks.
There was a shark attack.
A shark attack in northern Israel or something like that, right? Was it like near
It
Haifa
happens.
or something like that?
Yeah, they say
happens.
they blame it on global warming, that the waters were a little warmer and
So there's sharks
there
now.
were sharks and people were like, some people were playing with the sharks, petting them, whatever,
I
and
don't know if I'd want to do that.
I don't
grabbing
know
them
if
by
I
the
would do
fin.
that.
And
I
then
would
one
not do
shark got a
that.
little upset. And,
Nice shark, nice shark. Oh, not such a nice shark.
Yeah, no, but you know, the water in the Mediterranean is generally warmer than the one in the oceans.
yeah.
Oh, I tell you one thing was
And-
interesting. When I was in Tel Aviv, I mean, the water, you go in, there's no getting used to it. It is perfect.
It's nice. We used to go surfing and sailing in the winter in Tel Aviv.
Wow, that's great, you know.
It was,
Yeah. It's a
you
great.
know, I do make an
Great
attempt to
beach.
go every summer to Israel. You know, well, I still have my family there, so.
Oh, your parents are still there?
Well, my father passed away, but
Sorry about that.
and my brother and my sisters are still there.
See a lot of relatives there.
I have a lot of relatives and friends.
Yeah.
Where are you from in Israel originally?
Well, I grew up in Bat Yam, which is just south of Jaffa.
My aunt used to live in Bat Yam.
Yes, it's
A lot of
think it's the
Sephardic Jews
third
live in
or-
Bat Yam.
Yes, it's the third or the fourth largest city in Israel as far as population. And I grew up there. My parents lived in that apartment since I was born, pretty much. And well, now my mother lives in Sfat, which is where my sister lives.
Right, which is a Kabbalistic city.
It's beautiful
I
there.
love that city.
It's beautiful. The only problem with it, in the winter it gets cold, and I don't like the cold
So
weather.
How cold does it get?
It gets cold.
Does it snow?
Yes, they do get
Snows
snow.
and snows and Sfat.
They do get snows. I mean, it's high elevation. It's
Yeah, that's
next
true.
to the Golan Heights.
Yeah, that's
Yeah,
true.
and they're skiing actually somewhere out there, right?
Yeah, the Mount Hermon, which is
Mount Hermon, yeah.
in the Golan Heights. It's kind of like on the border between
Lebanon.
Lebanon, Syria, and Israel. You know, but it's just cold. But otherwise, it's a beautiful city. But I grew up in Bat Yam, and I spent most of my young adults in the center, Bat Yam, Yafo, Tel Aviv. And then after I finished military, I rented an apartment in Tel Aviv with a couple of friends from the military for about a year and a half. Then I moved back to Bat Yam, got an apartment there, opened my schools.
You had the schools in Bat Yam.
Both of them were in Bat Yam, yes.
Yeah.
Both of them were in Bat Yam. And then 85 I was like 20, almost 27 when I moved here.
Yeah. No, that
Shocking moving here probably from Israel. Like just a culture
Well,
shock.
yes and no, because the people that I associated initially were, you know, in Forest Hills in Queens.
Sure.
big Jewish population.
There are some
There's
Jews
a lot,
in
lot of
Forest Hills.
Israeli expatriates who are there, and
Back in the 80s, it's like, almost like you didn't change the neighborhood.
Wow.
but your
interesting, yeah.
English is excellent.
Well, first of all, in Israel, back then, I don't know about now, but back then, English was a mandatory language.
It was required.
Required since third grade.
Yeah, so
And-
you know, whenever you go to Israel, you can. There's no lack of English speakers.
It's amazing how like we're the only country where you basically you go and you go to a different country and they all speak English, and then they come here and nobody can speak their language basically unless you go into that certain population of the city where they.
Well, in Israel, every highway sign and most of the street signs are in 3 languages. They have them in Hebrew, English, and Arabic.
Yeah, and I think they're having Russian signs now
Yeah.
too.
Well, depends on the
yeah.
yes.
It was still good to have a guide when we went to Israel.
Well, of course, 'cause
Definitely
they,
need
helping
a guy.
us.
they know. But yeah, so English was mandatory, and but what you study there in English is not American. It's English.
Right.
This is American.
Right.
It's different. But, so I had no problem with the language. I had no problem with this. It was just adjusting to a different lifestyle in a sense of society, if you will. Because it's still not Israel. It's still an American society.
Yes.
So it has different values, and I realized that I'm moving to a country that's not Jewish. It's Judeo-Christian, that's how you say it?
Judeo-Christian.
Yeah. So, you have to accept certain things, which I did, and certain things I maintained. I accepted the fact that, on Christmas everything is closed, but on Yom Kippur everything is open.
Our office is closed.
Well, my school is closed too, but that's my choice. That's my personal business. So you have to just accept these things and move on.
What's interesting is that a lot of Israelis are secular; they're not religious in Israel, but then they come to the United States and they find religion.
Well,
it's
yes. For me, it was more. See, when I lived in Israel, I did not keep kosher. I did not. My parents did. My parents were very Orthodox, still are. But outside of my parents' house, if it was on my plate, I ate it. When I came here, the first thing I did is start keeping kosher.
Wow, that's interesting.
Yeah, because it identifies you as a it connects you to your homeland, connects you to your religion.
It connects you to Israel, and then I go to synagogue. I go to this more than I did when I was in Israel.
Yeah,
that's very interesting.
a lot of Israelis describe that.
Well, because you want to keep the connection to your homeland.
Sure.
Yeah, my aunt who lived in Bat Yam, on Yom Kippur in Israel, she would go to the beach. That was a beach day for her. It was like a day off. And I said to her, "What are you doing? That's like the most."
Because nobody's there.
She said, in America, you're Jewish on one day of the year when you go to services on Yom Kippur. But in Israel, we sacrifice every day to be here.
Yeah.
So, it made an impression on me.
Yeah, it's a different mentality, and like today is actually Holocaust Day.
Yes.
And in Israel at 10 a.m. in Israel, they had the sirens.
And everybody stops.
For 2 minutes. The highway, dead stop. Car stops, people stand up and stand in attention for 2 minutes. It's a different mentality. It's a different environment. And that's what they do. And they have ceremonies and all that and so on.
Yeah, no, it's a special place.
Well, I mean, I tell you, thank you so much for coming here.
Of course.
And I'm so glad you had a nice result from her surgery.
I have to thank you guys, because if it wasn't for you, I'd be in pain.
Well, I'm
not able to do things.
It goes to prove that when you're in good physical shape to begin with, it makes your recovery easier as well.
Yes.
If people who are in really bad shape, we've had people come in and have operations who were in wheelchairs before. Now they're walking afterward, but still, they, to reach that level of being able to compete as an athlete, and to, it's a tribute to you of what you've been able to do with
great
your motivation and your recovery and your dedication to getting better. And everybody has a tough time after an operation. It's painful. It's a struggle. And you've really done a fantastic job in terms of your recovery, and we're grateful for that. And thank you for sharing your story with us.
Yeah, thank you for sharing your story, and thank you for coming in here all the way, to be with us.
Well, thank you.
Yeah, no, we appreciate it, and we
coming
we
by
admire
to
you.
see the Spine Bros.
The Spine Bros. Yes. Well, it's meant to be.
It's a serious.
That I
still
ran
a very
into you and
serious
then
business.
into you, and then we're here.
It's a very serious business. But this when you involve caring for people's spine problems like this.
Well, thank you.
And it's always a rewarding thing to see somebody like you come in like this and telling us about what you're doing like that now and these fabulous things,
Yeah, I mean, Peyton Manning, who was an American football player, had a neck fusion, a cervical fusion to his spine, and he was able to go back and play professional football. So
Wow. I mean, I know who he is. I didn't know he had a surgery.
It just goes to show you.
he had a surgery.
You can do stuff after surgery.
Yeah. So that's another example of being able to recover. And being and what you start with helps tremendously in terms of your post-operative recovery.
Absolutely.
Well, I'm glad. I'm happy to do that again.
Great. Well, thank you very much again.
Thank you, Doc.
Yeah, thanks.
All right.
Doctors.